just so people know that we are recording. And I do want to welcome you all to our first in our 2024-2025 webinar series that's being hosted by the Canadian Housing Renewal Association. My name is Mel Willerth. I am the Senior Manager of Education. I use they, them pronouns, and I'm happy to welcome you here today. Before we get started, I do just want to do a brief little land acknowledgement, recognize where we are. Interestingly, all three of us on screen right now are located in Treaty 6 in Amiskwaciwâskahikan in Edmonton. We are in a territory where we've been learning from the Blackfoot, Lakota, Assiniboine, Dene, the Métis people of Western Canada. I recognize that we're going to have people joining us from all across Canada, from different nations, from different treaty lands, or from unceded territories, especially as we're coming up to National Truth and Reconciliation Day on Monday. I want you to be, paying attention to these lands and doing what learning we can. Today's webinar is going to talk to us about data, which is very exciting. Data is something that we've been seeing a lot of our members want to talk about and learn about. So data and housing. We've got two fabulous presenters from the Bissell Centre. We've got Lacey Chandro, who's the Manager of Analysis and Evaluation. Lacey has over 5 years of experience providing clients with a variety of business needs, primarily in the areas of research, data analysis, and evaluation. She is currently an MBA candidate at the University of Alberta, focusing on public sector studies. At the Bissell Centre, she leads all data collection, analysis, evaluation, and reporting processes across Bissell's 12+ programs. It's a lot of data. We also have Mutasim Mubdi, who has over 5 years of experience in primary research, data analysis, social and economic policy analysis, and evaluation, completing a Bachelor of Arts in Economics from Brak University in Bangladesh. Mutasim worked as a research assistant across 4 projects for 3 years. There he helmed a year-long multi-country research project as the primary investigator before coming to Canada to pursue a Master of Arts in Economics from Simon Fraser University in BC. Mutasim is responsible for all research and technical analysis of the Bissell's program data. Thank you all for being here. And I'm going to turn my camera off and turn it over to our two wonderful presenters. Please feel free to put questions into the Q&A and we will get to them at different points throughout the webinar.
Wonderful. Well, thank you for the warm welcome. Mutasim, if you wouldn't mind sharing your screen with the presentation, we'll get going here.
It says host disabled participant screen sharing. So yeah, I think we need permission for that.
Mel, can you help us out on that part?
Yes, I can. Let's see here. How do we do that? Oh, let's do co-hosts. That might help. Did that work?
Yeah.
Excellent.
All right. So.
Perfect. Thank you so much. Okay. Well, just a brief little intro to the Bissell Centre for those who may be less familiar with our organization. So the Bissell Centre is a nonprofit here in Edmonton that aims to move people out of poverty. So we have, as Mel mentioned, 12+ programs. About almost half of them, I would say, are housing programs, and the other are more poverty and quality of life focused, such as eviction prevention, family supports, mental health supports, and a variety of other things. So before we jump into content, if we flip ahead to the next slide, I'll give you just a quick snapshot of what we'll cover today. So here at Bissell, we use a self-sufficiency matrix to collect data around quality of life and measure that data over time. So that will be the primary focus of today's conversation. So we'll walk you through what is that, how did it come to exist, how does it work? Why do we use this tool? And then Mutasim will dive into a section of our results that we've been able to pull from our analysis, primarily on our housing programs. And then we'll close with some narrative around the ongoing challenges and improvements that we're working to improve upon with the use of our tool, and open it up to any questions and answers at the end. So if that works for folks, please throw questions in the chat along the way, and we'll hold some time at the end to dive into those. So a quick overview of the self-sufficiency matrix. So a self-sufficiency matrix is not something we came up with ourselves. So it was sourced from a variety of different research. So there's quite a bit of history behind the development of this tool. It was developed first in Arizona, where they used 15 quality of life domains, on average 5 questions used, to determine the scores for each of those domains. And we know that there are many contributing factors and facets which influence someone's quality of life. And the Arizona SSM took a very simplistic approach without incorporating a lot of nuances. And then we move into the LifeWorks SSM. LifeWorks is a nonprofit social service organization in the United States. They improved on the Arizona SSM and developed 5 additional domains. They expanded the question slightly to incorporate some nuance, but created a bit of a trade-off between the ease of scoring and comprehensive representation of someone's quality of life. So we decided to take data on very few. So we used just 6 quality of life domains, but in a much more comprehensive fashion. So Bissell's questions exhaust many facets and situations that can influence someone's quality of life, as well as those facets and their impact on the quality of life. So something could exist but have minimal impact. So we try to get to the more realistic implications of those things. We use nodal analysis and determine appropriate weights behind each of the scoring of someone's responses to the questions to get some consistent scores across our different areas that we can measure over time. So the 6 domains that we use here at Bissell are mental health, physical health, support network, employment, financial well-being, and housing. And so as I just mentioned, we do comprehensively dive into each of these, and these are also tailored to align with the programs and impacts that we're aiming to create with those programs here at Bissell. So all of the data that we collect is collected by social workers, frontline staff, who are balancing their time between providing services and entering data. So there's a little bit of administrative logistics in there to ensure that we're using an appropriate amount of time and resources to gather the appropriate amount of data. So we have to be a little bit streamlined in providing valuable insight to the workers collecting it, participants receiving those services, and then supervisors monitoring the programs overall. We also aim to use this data operationally to make decisions about where to refer participants based on their kind of current state in life, and inform their case management process. So it's not just for research, it is also to help support people in getting access to the right resources and right programs depending on their situation. So if someone starts out in a housing program but could also use employment supports, we take that into consideration through the administration of the survey and aim to connect them beyond just that initial intake. Yeah, so if we look at this next table here, this gives us a little bit of a snapshot as to how we score things. So we have a 1 to 5 scoring system that we use across the 6 domains. So 1 is in crisis, we move up to 2 is vulnerable, 3 is stable, 4 is safe, and 5 as thriving. So the idea is that as folks answer the questions, depending on their answers to the questions, it will create a score for each of these domains, which weights the answers of a large handful of questions to give them a score across each domain. So housing will have a score, support network will have a score. So you could be thriving in housing, but be in crisis in financial well-being. So it gives us scores for participants across each of the domains. As well, we can look at a participant's overall quality of life across all 6. So we'll dive into that a bit more in the results in a little bit. And then when we look at measuring these in terms of our timeline, We conduct a starting point survey on these 6 quality of life domains when a participant is being enrolled into one or sometimes more programs here at Bissell. Then we aim to follow up with each participant with an outcome survey, which is essentially the same questions, just at a different time frame. And we aim to do this 1, 3, 6, 9, 12, 24, 36 months, depending on the timeline of the program, to be able to measure the journey of those different quality of life aspects over this time and understand the impact of our programming on them. If a participant is enrolled in more than one program, only one survey is conducted following, that initial consultation with caseworkers, and all caseworkers that representing programs that the person is enrolled in are involved in that initial conversation. Participants can also graduate from a program and re-enroll later in the same program or a different program. And for these cases, we consider these separate for the purposes of analysis. They will have separate journeys along the timeline. And then lastly, before I hand it over to Mutasim to dive into the more exciting results, why do we use this tool? So this tool allows us to do longitudinal analysis over time, so we can understand the impacts of our programming across the different domains and understand, the timelines associated with seeing those impacts. So what does an impact at 3 months look like versus what is an impact at 9 months? And where is our reach of impact really occurring with our programs? It helps us inform any adjustments to our programming to make greater impact. So if we're not really seeing results, we're able to share that back with program staff and inform the design and administration of our programs. We have the flexibility to adapt our questions to better understand the impact and the changes that our programs make. So we've recently just undergone a revision process to our survey to better collect more useful data, really tailored to what our programs are trying to achieve here at Bissell. So because we've kind of crafted it based on research, we have that ability to adjust it over time and make sure that it's still up to date with the programs that we're offering. Really, the bulk of it is that it allows us to use data to tell a more comprehensive story of the impact programs have on people beyond, a simple documented outcomes. So as we just saw, you can look at it across six different domains, and you can look at those domains across each and every one of our programs to see which programs impact which the most and where we would hope to see more or surprisingly see greater impacts. And then for those involved in more than one program and things like that, we are able to understand a bit of the spillover and effects of that, of being enrolled in, say, a housing program, an employment program, and what the combination of those enrollment and opportunities does for someone's quality of life. So with that, I will pass it over to Mutasim, who's going to talk you through the analysis approach and some of the results that we're able to gather from our data.
Thank you, Lacey. So first of all, just to give like some basic understanding of some of the analysis that we're doing. So whenever we get the data, we have some problems with the data itself. So we have to clean the data. We have to do some validation checks. We have to see if the people or our participants' data is being collected at the right timeline or not. Sometimes, given the very nature of the community members and the participants that we serve, sometimes they end up going missing for a couple of months, and then they come back again when they need the services. So those are things that we need to correct in the data before doing the analysis. So that's the first step. Then we have to populate and match it with all the programs that they're part of. So you'll notice that Lacey mentioned, if someone is part of multiple programs, they do a case conference and only one outcome is conducted. But since they are part of, say, more than one program, that same data has to match with with the associated programs. After that, we calculate the means and the medians of the quality of life scores. We compare the starting points and outcome averages across the different domains. So we do the mean difference tests. These are the statistical tests that we do at the most basic level. There's also the matched pairs sign test or the median difference test. We also do a distribution difference test and an independence test, just to basically understand, whether these improvements or the detriments that we're seeing, whether are they flukes or are they statistically significant to happen because of our programming. So, for example, this is, so apologies. So for example, this is our changes in the mean scores across 6 domains, but for all programs. So you'll notice that for our housing program, it was at 2 on average, which moved to a 4 on average. For our participants, these are the number of participants on whom the data or the mean difference test was conducted. And so in here, it's a bit unintuitive because green usually signifies improvement and red signifies decreases in here. But unfortunately, because of the color scheme, the blue is the percentage of people or our participants for whom our scores increased. Green is no change, and red is for those it decreased. So we see the biggest increase in the quality of life, specifically for housing, and that's across all programs. We can look at it for each of the different programs that we have at Bissell. So we see very minimal improvements for support network, employment, financial well-being, physical health, and mental health. But this is when we look at all the programs in aggregate. So if we look at the next program, which is, if we look at, say, specifically for people who are starting at the most vulnerable state of their quality of life, which is they are in the crisis or the vulnerable scores, we see significant improvements in housing, support network, employment, physical health, and mental health. So financial well-being is the only domain where we don't necessarily see much improvement. Again, this is for all programs. But for a more targeted look, say for the housing program, we notice that people go from on average mean score of 1 to a 4 in housing because, well, that's the targeting, that's the programming that we're providing. If it didn't happen like that, then that would mean our programs are failing in some way. But the other thing that we should notice is that both the physical health and the mental health also improves for the people that are getting the housing programming or being part of the housing programs at Bissell. So this is roughly a correlation of the different domains in both the starting point and the outcomes. So in the starting point, you notice that they're all more or less clustered together, but there's no specific trend. But in the outcomes, when we see that when housing scores have improved, when they reach around the 3-4 band, then there is a positive correlation with all the other scores. So this implies that, if housing, so this is like an evidence for the housing first mentality or the theory that is going on. So if you can address the housing problem first, all the other aspects of the quality of life is going to improve. So this does give some degree of evidence for that, and we are going to be exploring it further as we move along. So we have 3 programs in Bissell that provide housing services or housing related programming. The first one is the Hope Terrace. So this is our permanent supportive housing. And that is that is for both general people that are houseless and also for people with FASS, fetal alcohol syndrome spectrum, or yeah. So and we have the outreach housing where basically we have a team who are on the streets where they find vulnerable people and then they try to house them or provide services to improve their housing conditions. And the third one is the homeless to homes and the encampment to homes program. So they are more targeted towards providing bridge housing and market housing, but for a very specific group of our participants. So in here, our outreach housing team, since they're mostly just finding people from the streets and then putting them somewhere to live or providing them with very short-term services, they don't necessarily do a starting point and outcome because the timeline doesn't necessarily acclimate to the type of services that they're providing. The other program that is somewhat related to this is our Community Bridge program, which is an eviction prevention and a utility disconnection prevention program. So this gives interest-free loans to our participants, to very specific participants who meet our eligibility criteria, who are given this one-time loan, interest-free, that they can use for either preventing their eviction or paying for their utilities. That is something that is, so we have seen in our data that it's usually people who are in the vulnerable state of the housing quality of life who end up falling into this category of services or who come to avail these type of services. No, and the people who are getting a score of 1 in their housing domain, they're the ones who doesn't have a home at all. So these three programs, except for the outreach housing, are basically from whom we are collecting the data from. And we look at, so this is how the average housing score changes over time for housing program and the non-housing program. So the non-housing program are the ones in the blue, and the housing program is in red. So you'll notice that on average, the average housing score for our participants in the housing program is lower in the starting points because those are the people that we're targeting. But the improvement is significantly higher relative to the people that are not part of the housing programs in Bissell. So in here, for the non-housing programs, you notice that they also see improvements, but the improvements seem to taper off at some point, oscillating between 4 and 3. But for housing programs, we immediately improve it up to almost a 5 in 3 months. And after that, we don't necessarily see any improvements anymore. So that's why there's a decline in the other half of the red housing line in here. So we wanted to explore this difference of being in a housing program and a non-housing program more intently. So we developed the ordered logit estimation because there are 5 different scores in housing that they can get. And since we're looking at it at the analysis over time, so that's a panel analysis or a longitudinal analysis. So we combine these two processes in the regression analysis with a few variables of interest and some controls. So our primary variable of interest is which program they're a part of. So whether they're part of the housing program or not. So it's a binary measure. We also want to have the time variable in there, which is our starting point and outcome periods. And we want an interaction between the program and the period just to see as time moves forward, how does being in a program affect this? So this is, if anyone's interested academically, this is a difference in difference or a randomized control trial way of approaching the problem. As for controls, we are controlling for the demographics. We have the sex of the participant, we have the household type, we have their age and the square of their age. We have their residency status and their ethnicity as demographic controls. And for individual controls, we're also looking at the log of their income, whether they use substances or not, and what their physical and mental health scores are. The reason we include the physical health and mental health scores is, well, there are 2 reasons. One is sometimes getting into a house, whether it be market housing or permanent supportive housing, there needs to be an assessment of whether they are fit to be put into that housing or not. So in there, the physical health and their mental health scores are something that works as like an eligibility criteria that they have to fit into. The other aspect is whether someone can maintain their housing or not is significantly dependent upon whether their physical health scores and mental health scores are good or not. So that's something that we want to also control for. So this is on the primary variables of interest, even though we have, it was an ordered logit, so we should be having like 5 coefficients. This is an average of all the coefficients in here, just for the simplicity of showing it. The more important thing to notice in here is anything that is on the right of this red line means that as that variable increases, or as we move forward in that aspect, our housing scores improve. And anything on the left of this red line, that means it is lower relative to the other option. So in here, of course, the participants that are in the housing program have a lower score than the participants that are in the non-housing program, because we are targeting the people who are more vulnerable in this aspect. So because of that, we have a negative coefficient here. But you'll notice for the period pieces, as we move forward in time, all the coefficients are positive relative to our starting point. So meaning that relative to their starting point score, the more programming they receive, or the longer of a programming that they receive, their scores improve. The third set of variables that we have is the interaction between the program and period. So in here, this shows that being in a housing program in the first month has a large positive impact relative to being in a non-housing program at the start of their Bissell programming. Right. So we see a significant improvement across at least up to 9 months. On the 12th month, we don't see a significant improvement. The stars signify how significant our results are. So 3 stars basically means that the result that we're getting we can only get that at random for 1 in 10,000 cases, or 1 in 10,000 analysis of the same data. Right. So just to see how each of the scores move across time, and by being in each of the programs. So you notice on the left here, we have the marginal effects, or the effect of moving from one period to the other, how that affects the people who have a score of 1, which is in crisis. And this is for those who are in a score of 5. So in here, on the left or on the y-axis, we have the probability, or the effect of the probability. This basically means that as we move from our starting point to our first month, the probability of being in crisis reduces by almost, so this is going to be 80%. So this is going to be 0.8. And moving from 1 month to a 3 month, their probability of being in crisis reduces by 85%, because all of these things are negative. So the blue line signifies that being in a non-housing program, their housing scores are still being affected. So even not being directly targeted through the housing program, they would still see a reduction, or there is still a probability for people who are in crisis in the housing quality of life to see movement to other scores, or other, so basically other scores, to either a 2 or a 3 or a 4 or a 5. But we see more improvement for the housing programs because of the targeting that we're doing. The same goes for the people in the score of 5, or who are thriving in the housing quality of life. We see the improvement for housing is more than the non-housing programs, or being in the housing program relative to not being in a housing program, which is consistent with our efforts and the way the programs are set. Because if our results were not consistent, or if the results did not show this, that would mean that either our housing program was not doing the things that it intended to do, or the analysis that we're doing is not on par to find or figure that thing out, or figure out whether we are actually having an impact or not. So as for the other variables that we had, or the controls that we had, so we see that if someone's income increases, their housing scores also improve, but by a very small margin. Someone's age is, the older they get, their housing scores tend to decrease. So one of the reasons because of this is because their health conditions tend to worsen as people progress in age. And their mental health conditions can also be affected. There are also the use of aids and accessories. Sometimes people need to use walkers, wheelchairs, and maybe their housing conditions don't necessarily allow having those sort of aids and assistance or disability-friendly homes. In terms of using substances, we see that people who use substances have a reduction in their housing scores. Sex seems to be irrelevant. There is no significant difference between males and females. For household types, we only see that people coupled with children tend to have a more significant improvement in their housing scores relative to all the other categories, whether they're single or single with children. This is, unfortunately, this is how the society is set up. We tend to give more importance to familial structures where there is a couple and the children, and less importance to someone who is single with the children. And these are societal taboos, and unfortunately, this is reflected in our data as well. Then we have the interaction of sex and household, just to see if being a female single with the children or a male single with the children, are there any differences in their results? We don't see any significant difference. Being a citizen or a temporary resident or a refugee doesn't have any effect as well, not any significant effect as well. In terms of ethnicity, Caucasians and indigenous people, they don't necessarily have any different quality of life in terms of housing. However, people who are other, say immigrants, they do tend to have a higher, statistically higher or statistically improved quality of life housing score. It might be because immigrants tend to be centered around certain geographic locations. So there's like a community that's there as a resource. So whenever someone comes in from another country, they can tap into that resource more easily relative to, say, indigenous and the Caucasian people that are homeless. Yeah, so next up, so how does our physical health and mental health score affect the housing scores? You'll notice that being in the physical health score, the more vulnerable you are, the lower your housing scores are going to be. However, that reduction in housing score reduces as we move more and more to, or as we move higher in the physical health scores. In terms of mental health score, however, we only see that people with stable mental health score have a significantly higher housing score. Right. So all of these were from the panel ordered logit estimation or the regression that we did to basically understand how these things affect our housing scores. But there are 5 other domains on which we are collecting data on, and like 11 other programs. So one thing that we can look into is how does the correlation of the different scores affect each other. So you'll notice that in here, we're showing that being in a housing program versus a non-housing program, how the social support network scores change. Please ignore the typo in here. Unfortunately, I have mean housing score. This is not mean housing score. This is going to be means social support network score. So in here, we don't necessarily see a stark difference between the housing and the non-housing program. For the other one, this is for the employment scores. We do see that being in the housing program after 6 months, there is improvement in the employment scores. But the employment scores for being in non-housing programs are, well, relatively unaffected. One of the reasons for this is, like, many of the participants that we have don't necessarily have the correct documentations or IDs to actually move into the workforce. There's a very small window of opportunity as well. Many people, many employers are unwilling to provide them with work, provide the type of participants that we give support to or services to with work. And then there are also many of our participants who are discouraged to the point that they don't want to look for jobs anymore. They're basically surviving on the not-profit services. So because of those reasons, like for the non-housing programs, we don't see anything. But however, being in a housing program for at least 6 months, this seems to indicate that perhaps they are more encouraged, or they are in a more stable position in their life to go for employment again. So this is what we're seeing from this, which again requires further analysis. For the financial well-being scores, we see that there's not really a big difference for being in a housing versus a non-housing program. In the physical health, also not necessarily a big difference. For the mental health, there is a difference between our housing and the non-housing program, specifically on the 6 to 12 month period. One thing to keep in mind is that some of the housing services or the programs that we provide are on short term and some are long term. So Hope Terrace is long term. So the 9 month, the 12 month, those are things that would come from our Hope Terrace. The 6 month is largely coming from our market housing, which is H2H and E2H programs. So typically it's we provide services. So after we house them, we are in conversations with them or in connection with the tenants for about 6 months or so, and afterwards they are without Bissell support, explicit support. So because of that, sometimes there are certain problems that they face, which is why their mental health can decrease. But in terms of Hope Terrace, it's people with FASS that are largely housed in Hope Terrace, and that's something that is being reflected in here as well, because people with FASS tend to have a very fluctuating mental health condition, and those are very prone to environmental conditions. So if their neighbors or someone in their flat is being very rowdy, that's going to affect significantly, that's going to affect their mental health significantly. And they end up creating a ruckus, which affects the mental health of other tenants in the permanent supportive housing. So yeah, these are likely those because of those scenarios. However, it also requires further analysis. So in here, all the analysis that is to follow is mostly going to be on the spillover effects. So specifically, providing housing, how does providing someone with housing programs and housing services affect the other scores that they have? So how does their mental health and physical health improve, as we've been seeing from the last few slides? The problem with analyzing this is that we can't do the analysis at a vacuum. So we will have to do this in a manner using structural equations. The problem is that we have 12 programs, we have 6 scores, and 6 domains, and each of the domains has a correlation with each other. So that's 6 times 5, 30 into 12. So that's 180 equations that needs to be estimated, which is not computationally possible in the RAM that we have. So that's something that I'm trying to figure out. The other thing is there is simultaneous causality that's happening in here, right? So we have housing scores or improvement in housing that affect physical health, that affect mental health. We also have, but that improvement in mental health also feeds back into improving their housing scores as well, or some other scores as well. So because of the simultaneous causality and how it's like flip-flopping, going back and forth, and one domain reinforces the other domain, that's also something that creates more complexity in the analysis and makes it more computationally heavy. So one of the ways of figuring out whether there is simultaneous causality or not is by looking into co-integration effects, whether like, so if you So for a basic example, so in a demand system, right, you have price and quantity. Increases in price means that less quantity is demanded, and so but as quantity decreases, the price increases even further. So that's something that can be analyzed through co-integrations. So that's something that we can actually use in the case of our quality of life as well, to estimate whether there are the simultaneous causality between the domains as well. The other thing is we have targeted programs beyond our housing programs that actually can have effect on our housing scores as well. So we have the mental health program, which is going to, well, directly affect the mental health or domain of our participants or our community members. But that improvement in mental health can also feed back into improving the housing scores or housing stability. We also have the workforce development program that's providing that used to provide direct services to the employment domain of our participants, and that again can feed back into our housing scores. So those are things that we are going to look into further. So that is mostly my side. Well, that is all from me. I'm going to pass it over to Lacey for the final few slides. Thank you.
Thanks, Mutasam. So just a quick note on some of the challenges and improvements we've been working through with this tool. So it's been in place for quite a while at Bissell. And over this past year, we've done significant changes to the way that the tool is used. So primarily, a handful of things listed here on the slide. So the first is just a need to update the language so that it's trauma informed. So we've been very cautious of the state of folks who we're supporting in programs and services, as well as the staff delivering the survey, and have really done some work with a working group from frontline staff and leadership to update the language across all questions to reduce any trauma and triggering language that we can. We're looking into we've looked into survey fatigue and how we can reduce the questions to be more mindful and get valuable data by asking more thoughtful questions, as opposed to 8 to 10 questions that we then have to piece together to tell the story. Capacity as well goes right along with that. So the time it takes for our staff to deliver the questions has been flagged as an additional investment into that case management process. So want to make sure that we're considerate of that process and what that looks like in their day-to-day, as well as modifying outcome survey timelines. So I know Mutasam mentioned that some of our programs are more shorter term and some are more longer term. So working with those programs to identify when makes the most sense to collect those outcomes. If we know that there won't be any programming past 3 or 6 months, we can adjust the compliance rates accordingly. And then we've done some updating to our domains, really just to ensure that the questions we're answering are focused and useful information, and not just asking questions for the sake of questions. Additionally, with the updates to domains, we've done quite a bit of work and research to support decisions around how things are scored and how things may impact someone's life. So a great example of that is we've done some rework to our physical health domain, which previously was largely physical disability based. So if you had a physical disability, your score would automatically be reduced. We've done some work to consider the reality of that for the actual people experiencing those disabilities, and understand like you may have a physical disability, but it may not, or may minimally impact your quality of life in the physical health realm. So adding some different questions to really understand, does it impact, how often it impacts, to ensure that the scoring is reflective of those real experiences and not without context. So we've done quite a bit of work to improve it, and are currently launching a new version in October here with our team. And so it's kind of an ongoing improvement process as well. We work with the teams periodically, and of course with this new launch, to gather ongoing feedback to continue updating periodically to ensure that reflective of programs and services being offered, as well as some of these more logistical and administrative pieces that we're considering those as well for both our staff and the way that it's delivered to our participants. So with that, that's all we had for presentation today. I do see there's some Q&As in the chat that we can talk through. So the first question is, who is typically scoring the BSSM? Can the BSSM be adapted to self-report? If yes, do you have any resources or recommendations for doing so? So the scoring is done in the back end of the survey when it's administered. So based on someone's answers to a question, a score will be generated, and that has all been predetermined based on research and processes that have been in place here at Bissell. Mutasim, do you have any insight to speak to the self-reporting side of it? I know it's not a practice we currently use at Bissell.
So it's not very complex, the questions and the scoring system itself, at least not the LifeWorks version of it. Our version, one of the domain is a bit complex, but that doesn't mean that people can't self-report. As long as they have or they can have access to a survey like this, they can always do this at a periodic basis and then get that score themselves. Yeah. But one thing to note is like, so our scoring is like happening at the back end, so it's all programmed in, and depending upon the responses to the question, the scores are appearing. If someone wants to do this by themselves and they don't have that kind of system set up, they'll have to do that manually, which is not a problem, because our longest domain is the housing domain, and that has 13 questions at max. But depending upon the choice of responses, you can have lower. And our shortest domain has 4 questions. So depending upon how much time somebody wants to invest. Yeah.
Thanks, Matasim. I'm going to jump ahead to a very similar question while we're on the topic. Someone has asked if clients self-identify their rating or if staff assign a rating. So it's calculated based on the question or the answers to the question. So no human is determining based on judgment what that rating is. It is compiled based on how things are answered, as well as if you answer, you know, that you're you don't have, or you have debt, but it's a mortgage debt, that's different than if you have debt and it's you know, debt to a loan shark or something like that. So those situations will result in different scores, but all of the scoring is done in the back end of the tool, not by either the participant or the staff administering the survey. Next question here, in the graphs of the housing scores over time, what is happening at that 12-month mark? Does this data indicate that there's less improvement at the 12-month mark, or that their housing scores are worse at the 12-month mark? And Matasim is already jumping back to that slide. Turn it over to him to speak to it.
This one.
Housing scores over time. Doesn't specify what slide.
I think it's this one. So this is the average score. So the housing's average score, it's declining after, say, the 3 months, is because the next one, which is happening at the 6-month period, is after some of the participants have stopped receiving the housing programming or the support from Bissell. So for them, for some of them, this creates a problem. Some go back to some are evicted from their market housing, some go back to being houseless, some face problems with their landlords and end up having a lower score. And that trend continues at the 9-month and the 12-month period as well. So we have, so the permanent supportive housing that we have, which is a longer term program, we have at max, I think, 35 people living in there, but in the data we have 1,100 people that's coming in this data for the average calculation and also for the regression analysis. So those 35 people, regardless of their scores of how good they are at the longer term, has very little impact on the average score that we're seeing. So which is why if we want to have a more correct or accurate look at what happens to the scores, we look at the regression results. So this in here, it would imply that someone with a score of 5 has a high probability of being with a score of 5 at 3 months, and then a high probability of being at a score of 5 in 6 months, at 9 months. But at 12 months, it drops because, again, it's because of the weight of the number of people that are in the market housing relative to the permanent supportive housing that we have in our analysis.
Thanks, Mitasim. Okay, a few more questions here. The next one being, does Bissell allow organizations and researchers to use this tool free of charge? So unfortunately, this tool has been customly made for Bissell and integrated within the 2 data collection platforms that we use. So it's not an external tool that could be easily shared. However, Mutasim and I can share our emails in the chat before the end of the webinar. We are beginning to support external nonprofits in design and launch of things like this, as well as a handful of other data and evaluation focused tasks. So we're always happy to collaborate and work with you to produce some of that work. However, it's not an easily shareable tool. The next question is, how is the Indigenous population measured? Are there data specifying who is identifying as First Nation, Métis, Inuit, or mixed, and also if they are status and non-status? Mitasim, can you speak to this
Yes.
on the data side, and I can speak to the other piece?
Yeah. So as for the Indigenous identity, it's self-reported by our participants or community members. We look at the First Nation, Inuit, Métis, and whether they're status or non-status. We also take their treaty information and band information as well. So combining all of these, we create a binary measure of whether someone identifies as an Indigenous person in Canada or not. So this is only specifically for the Indigenous people of Canada or North America. So anyone else who is, say, an immigrant coming from another part of the world, but would be identified as an Indigenous in that part of the world, is not taken into consideration into this binary measure. Yeah.
Yeah, I don't have much to add other than, as Mutasim stated, generally it is self-identified, and that is used to determine if they do or do not identify. We primarily use the status or non-status information to help them get the supports available based on that status. If there are certain things, we can help them navigate to. But in terms of the identification, it is self-identified for sure. And then lastly in the chat or in the Q&A, I see a follow-up question to the first. Is there a way for us to access / use the questions clients answer that are then used to calculate to the domain scores? So similarly to the sharing of the tool, that's something that's been custom designed and is housed within Bissell's platforms themselves. Again, feel free to reach out. We're happy to have more conversations around how we can support designing a tool for your organization and things like that, but unfortunately not a universally shareable piece of information at this time. I don't see any other Q&As in the chat here. Maybe we'll give a few more minutes if anyone else has anything to add.
Also to add to your response and the last question, like the domains that we have selected to work on, like the 6 and the way they have been structured is mostly applicable to Bissell as an organization. So for other organizations with differences in program structure or differences in how the demographic of their participant or community members are, this tool may not exactly be applicable. So some degree of changes and reforms in the tool itself will be required to fit into the any other organization's objective and perspective and people that they're serving, the demographic. The other aspect is we're also limiting our data to only 6 domains. As you remember, the Arizona model had 15 and the LifeWorks had 20. So they do have more things that they're looking into, which may be more applicable for some other organization, which you can look into. LifeWorks is, I think, publicly available. And yeah, and we can always help create those things as well.
Yes, great points. Thank you, Mutasim. Another question just popped up in the chat here asking what data collection platforms we use. So all of the housing programs here at Bissell are mandated to use the efforts to outcome database that is kind of owned and operated by Homeward Trust, which is one of our primary funders. And then Bissell, for our non-housing programs internally, we're actually just switching from efforts to outcomes to a new Microsoft Power Apps platform-based database that has been, we've worked with an external developer to customly design that for our internal programs. Another question here, looks like one for Mutasim. How is the scoring validated to ensure it is accurately reflective of client experiences?
So this data, so this is last 5 years of data that we're analyzing. So periodically, we have been doing some inter-rater reliability tests, basically just seeing how each of the staff are conducting the surveys, how they're asking the questions, what sort of responses they're getting. We have the literature to back up how our scores are being handled and what sort of responses go into what sort of scores. So someone, if they're responding that they say live in a house, but they're couch surfing and it's a friend's place, right? Typically, you would think that they would be getting a high score. But the thing is, couch surfing is not a stable measure to, or a stable way of mitigating houselessness. So in our model, we would rank them lower to a more actually to a vulnerable state, so a 2. Because, well, they're living in a house, but then they're very vulnerable to being houseless, and that's going to be dependent upon their dynamics, whether they get thrown out or not. So these things we are vetting through both the literature, the consistency in the data, the validation over time from the huge swath of data that we have over the last 5 years, and also the inter-rater reliability tests that we're conducting. Since we have made some changes to our questions in the new versions that we're launching in October, we are going to be redoing all of these things for the new version as well, from the new data that we get.
And the only thing that I would add in terms of the consistency in that collection and scoring on a human level is our team is designing and conducting training with all of our staff administering the survey to, help them understand the correct way to answer questions based on people's experiences, do some role play of administering the survey and things like that to work with them to consistently gather those experiences and convert them into, the proper categories of scoring. Okay, well, I don't see any new questions popping up. Mel, did you want us to stay on if anything else comes up, or let us know where we're at?
No, I think if nothing else has popped up, I want to thank you so much for your time, for putting your email addresses into the chat so people can follow up if they've got other questions for you. Thank you all for joining us on this Tuesday afternoon, and look forward to our webinar series. Our next one is going to be on encampments, tent cities, which is something happening across Canada. In November, we're going to have domestic violence in your workplace. So that's something that impacts all of us, but also the different organizations or the housing projects we're working in. So look out for that one. And we're going to be announcing the January through June ones quite shortly. So thank you for joining, and I hope you all have a fantastic day.
Wonderful. Thank you so much for having us. And please do feel free to reach out if you have any follow-ups or questions.
Thank you.